Now, if you can remember the scenario after that interruption, what should she do first? Talk with Nurse Canterbury about the level of threat posed by Jimmy. Determine what the law is in their state relating to the treatment of mentally ill patients for the use of restraints, or just talk to Jimmy. My feeling would be A or B on this. I think you can really go either way. Because personally, I would do both of those. And as far as doing one first, I would do both of those before I did the next thing. So nonetheless. Now, when you do your exam on Thursday, I'm going to have a few lines underneath each, because you're just going to do this, but on paper, right? There'll be a few lines underneath where you can respond optionally. It's not extra credit. You're not going to get points by putting it there. But if for some reason you just feel compelled to explain yourself in a sentence, I just wanted to give you the room to do that, right? Okay, so Dr. Cheshire checked out the law. It turns out a judge's order would be needed. Okay, so we could have figured that, but nonetheless. But a judge may approve of the use of chemical restraints if it's reasonable to believe that Jimmy is a threat to the staff and that there's no less restrictive alternative that would protect the staff. And Dr. Cheshire then talked with the attending physician, psychiatrist, Dr. Douglas, and Dr. Douglas explained that Jimmy never acted violently, at least outside of his suicide attempt, right, towards anyone in the hospital. He did not view Jimmy as a high-risk threat, but rather as an extreme annoyance. That room. Dr. Douglas himself suffered Jimmy's racial epithets, but believed they're simply part of Jimmy's mental problems. So what do you think now? What should Dr. Cheshire do next? Inform Nurse Canterbury that Jimmy's not a threat and restraining him is legally and morally inappropriate. Talk with Nurse Canterbury, talk with other staff members, or just go back and talk with Jimmy. I would think B or C, all right, one of those two. Talking with Jimmy at this point, if the concern is partially that, this is part of a mental illness, we're not quite sure that he's going to be competent to give us information that we can use. Maybe somebody could talk to them, but I don't know. You'd have to really weigh how much you're going to rely on that. So, yes, talk with Nurse Canterbury, but I would guess she's involved as one of the staff members, which would be how I'd read it, okay? So, Dr. Cheshire then takes careful note of the psychiatrist's view and proceeded to talk with Nurse Canterbury. Nurse Canterbury explained that on 2 separate occasions, Jimmy lunged at the nurse's assistant, apparently trying to choke her. She thought that this was enough indication and believed that Jimmy should be restrained. Dr. Cheshire asked whether the psychiatrist knew about these instances. The nurse said he did, but since he's a large man, he seems unconcerned. He expressed hostility towards Dr. Douglas, the psychiatrist, and said he only thinks of himself and couldn't care less about the staff members who are with the patient on a regular basis. She also seemed to dwell on Jimmy's racism, leading to the suspicion that this was a motivating factor in a position to restrain Jimmy. In other words, it got under her skin, what he was saying. So now what? What should Dr. Cheshire do now? Now remember, a good way to always look at these scenarios is patient advocacy and I need information. If you keep pushing that almost to the point where you think, why do I need more? You need more. I mean, it's almost like you almost have to force yourself into asking for that, right? I think those are good choices. A person might go with C, maybe just to make sure that everything seems to be squared as far as Nurse Canterbury and Dr. Douglas understand. But having them in there, you know, if they're professionals, it's not like they're not going to sway it, but sometimes it's just best to get as much information. So either B or C. I think either one of those would be really good choices. All right, so Dr. Cheshire decides to talk with the head nurse in the psychiatric unit, Nurse Maple. Nurse Maple explains Jimmy's always treated by several team members, all right, so nobody's alone with him. She knows about the cases in which he lunged towards the nurse's assistant, but explains that he himself backed away after his initial weak gesture. Okay, so you're going to have to almost put yourself in a situation of you're there, and then one time he lunges, but then by you being there and confronting him, he just kind of like pulled back right away. So was it a serious threat? You almost have to like play this out in your head. Nevertheless, she maintains that Jimmy should be treated with appropriate caution, right? She doesn't consider him to be a serious threat, but she believes it's better to be safe than sorry, and insists that nurses do not see Jimmy by themselves and that they act with appropriate caution with around him, okay? So in other words, we know we have an issue going here. That's how you're going to have to start thinking of this in your head. Now what do we do? Decide to recommend against restraining Jimmy, or are we going to call for another meeting? Okay, so it's probably going to be B, even though this is what you're leaning on, right? You're probably not going to go that way, but you're not making the call yet. We're going to, okay, now that we have all this information and we know that we've been in there, and when he's lunged, it was a weak lunge the minute that somebody was there to witness it. So we're going to get all the people back here together, and we're going to go from there, okay? So during that meeting, several nurses and nurses' assistants, as well as Nurse Canterbury and Dr. Douglas, explained their views. After hearing that everybody agreed with that Jimmy, although disagreeable, was not a serious threat, all right? Because remember, if there was enough people in the room, as long as there wasn't just one nurse, he seemed to be okay. And Nurse Canterbury agreed that she probably overreacted. Dr. Cheshire returned to her office and finished a report about a case, and she thought this has now been successfully resolved. 2 days later, though, Jimmy hit a nurse with a telephone, and it caused a mild concussion. Jimmy appeared friendly and talkative, and so the nurses in the room let their guard down. And both nurses were talking near Jimmy's bed with their backs turned to him. Even though the telephone was several feet from Jimmy, they did not notice that he grabbed it. Although it's a mental health unit, such attacks are relatively rare in the unit, and the staff immediately physically restrained Jimmy. And the head of the unit, Dr. Sally Scottsdale, talked with Dr. Douglas about the proper path to take with Jimmy. They decided to initiate a drug regimen using a high dose of haloperidol. Oh my God, my mouth. Would probably restrain him enough to limit aggressive behavior. They also decided they would first need a judge's order to use the drug because they knew that Jimmy would not consent to it. Now, you might not pick up on something that was here, but we'll see. Now what? Was it morally proper to admit? In other words, I'm assuming, okay, even though it wasn't said, when the nurses who said the phone was thrown at them, they went and told the story. But they didn't they left out the part that they had their backs turned. Okay? So, that being the case, was it morally proper to admit the nurses let their guard down in treating Jimmy? In other words, they may have wanted him restrained, okay? And knowing that they give this information might actually make them look bad, right? So everybody knows that, nurses on the floor are responsible for certain things, and you can almost be thinking retributively, right, that is this going to come back on me? You got it. I mean, the last section didn't like this, but the reality is there's a higher threshold, right? So you have to be responsible in the room. And if you have a person who's known to at least be potentially violent, and you've already made a determination that you have to proceed with caution and never be in there alone, then you don't go in there with two people and turn your back. I mean, it doesn't make any sense. You know, you didn't act, in other words, even though you didn't intentionally aggravate the situation, the lack of due diligence escalated it. Does that kind of make sense? All right? So a judge ordered now, after it was all said and done, that it was permissible to chemically restrain Jimmy, so he was restrained until his release, about 15 days after the judge's order. What would have been the best resolution? Okay, now we're thinking back, right? If we had to do it over again, what would be a better idea? It's B. If this thing could be fixed by using different protocol, then that's what you do. Yes?
Under the study guide for the midterm review, there are 3 questions for complete study analysis. Would it be like this?
It's exactly like this, okay? So on your midterm, although I tried to really pick ones, in all honesty, that weren't as like, gray area. I tried to pick ones that it would be clear to you. So yeah, you're literally gonna have 3 just like this, and you will write directly on the paper, so those won't be in your blue book, right? And you'll just circle A, B, C. And I left a little bit of space after each one, optional. If you just feel compelled to write something to explain yourself, knock yourself out, but it's not gonna give you extra credit. And if you're entirely wrong, like, I'd rather you not pick that you're gonna come with a restraint of somebody. So picking that and saying, well, I don't care, I would do that, no, that's not gonna get you it. I think on 1 or 2 of them, there'll be like a little larger text box at the end where you can give me like 3 sentences, because I'm asking your opinion on something, like say this, that type of thing. But this is exactly like this, right? So, exactly. Okay.